any industry where there's monotonous sounds and you've been exposed to it a lot, you can develop deafness. You need to get an audiometry done. Not just an audiometry, you need to get an impedance audiometry also done. And the latest technology is where there is no battery involved. So again, the hearing aid body becomes even lesser and more concealed, and instead it is rechargeable like your truly wireless headsets. Hi friends, welcome back to Dr. Gladson Explains. Are any of you above the age of 50? Now, when you cross the age of 50, your body starts aging. For example, you start needing these glasses with double lenses, or like in my case, it's what we call two-in-one kind of glasses. So this is also an expression of aging. Similarly, you start growing deaf. This is known as presbyacusis. So how do you realize that you're going deaf? You could start hearing a ringing sound in your ear. Maybe late at night when you're sleeping, you get the ringing sound. But the ringing sound does not go away. It starts persisting. It may be louder in one ear and less in the other ear. It could be that you have a family history of deafness, so that's probably another reason. Or you're working in an industry where you're having a lot of generators, or you're working in that monotonous sound. Like in Bangalore now we have power looms. Like any industry where there's monotonous sounds and you've been exposed to it a lot, you can develop deafness. So this, not only that, another trigger would be you start developing a lot of wax. Basically, ears trying to protect you from the deafness. So by creating more wax to buffer that sound. So that is a warning sign that you may be going deaf. So if you frequently have to go to the ENT to get your wax removed, it could also mean that you're going deaf. So then you need to get an audiometry done. Not just an audiometry, you need to get an impedance audiometry also done. Audiometry is when they put a headphone onto your ears and they give you different sounds, and they ask you basically to signal to the audiologist whether you've heard it or not in the right ear or the left ear, and that way they are able to map up what is your hearing and what is the perceived deafness. So then what is impedance audiometry? Impedance audiometry is it's an objective test. Basically here pressures across the eardrum are measured, whether there is a negative pressure in the middle ear or is a positive pressure in the middle ear, and that tells us if there is any disease process there. So all put together, we are able to analyze what kind of a deafness problem you have. And now we've got lots of technologies to help you, right from hearing aids. Now hearing aids, the latest hearing aids we have for the elderly, it's called receiver in the canal hearing aids. Basically, earlier we used to have body-worn hearing aids. It was like a transistor radio and a wire. You could have seen your elderly having it probably around 20 years back. Then that went on to behind the ear hearing aids. They were like around the size of a cockroach sitting behind your ear. But many people didn't like that, and it had a tubing, and the tubing connected the ear. Now the thing was, in that hearing aid, the speaker of the hearing aid was on the device, and then a tubing transmitted the sound to the ear. What happened was there was a lot of hearing, sound loss due to the tubing, and that is why the quality of sound wasn't very good. But in receiver in the canal hearing aid, instead of a tubing, there is a wire that leaves the hearing aid, and the speaker is sitting inside your ear. So this way, even the size of the hearing aid, the body reduces. So the speaker can be now relocated inside the ear. And the latest technology is where there is no battery involved. So again, the hearing aid body becomes even lesser and more concealed, and instead it is rechargeable, like your truly wireless headsets. So you just put it on a charging dock, and after maybe a couple of hours, you can wear it again and start using it as if there was no problem at all. So this is it. And the advantage is how they are multi-channel hearing aids. So it can be for different environments. The hearing aid can be programmed so that you get optimal hearing in every situation. Like glasses, where you have customized programming of the design of the glasses, so that you, for example, distant sight has another customization, as well as reading you have another customization. So similarly, for hearing aids also, you have customized to in noisy environments, in different like a theater or an arena, or if you are in a home, or if you are in the ground open air area. So all these different environments you can customize it, and when you don't need to go to the audiologist clinic to do it. Basically, it comes with an app which is paired, your hearing aid is paired to your phone, and the phone connects to the audiologist. So that way, the audiologist sitting in a clinic is able to program your hearing aid, and you're probably at a movie theater watching a movie when you have pressed the help button on your phone, and then the audiologist keeps talking to you through your hearing aid, and then once you are happy with the hearing, he sets that the reconfiguration as a separate program. So these multiple programs, and the moment you go back to a similar environment, the program switch to that what is most optimum required for that environment. So this way, these programmable hearing aids have made life wonderful for the hard of hearing. So please make sure to meet an ENT if you have any of the symptoms I described above. And all the best and happy hearing. Bye for now. And please don't forget to subscribe, to comment and share my videos. Thank you.